Tonight, thanks. And back home, a major push to speed up testing for coronavirus antibodies. Tom Costello now on why it could be the key to getting Americans back to work.
It could be a game changer to protect frontline paramedics, doctors, and nurses, and maybe reopen the economy. A simple finger prick blood test to determine whether someone has already been exposed to the coronavirus with or without symptoms, recovered, and now has the antibodies.
That would mean that you're no longer contagious and you can't catch the virus because you have the antibodies in your system, which means you can get to work, you can go back to school, you can do whatever you want.
Already, New York State is ramping up production of the test kits. Similar efforts underway at Stanford University and North Carolina. The results available in minutes.
And we're hoping that that will ultimately give more insights for the health departments of how it's being spread and what the true presence of COVID-19 is in the population.
The FDA has given emergency approval for a test with widespread testing as soon as May.
We can test people to see if they've been exposed, immune, and go back to work. And a combination of that kind of test with the current kind of test we have now is how America opens back up.
But testing isn't always successful. The UK ordered 4 million antibody test kits and found them to be unreliable. Germany is considering issuing work permits to people who test positive for the antibodies, but that could be months away. Importantly, the antibody test is not the same as the test to determine if you currently have the virus.
But as we're working on the crisis of today, we're looking to the future to ensure we have the systems in place to bring those early alert systems together while we work on the antibody testing.
Most researchers agree with Governor Cuomo that it's unlikely you'd get the virus again if you have the antibodies, though they need hard science to prove that. Lester?
All right, Tom.